Hi everyone, welcome back to our channel Dentistry to the Point. This is Dr. Drumel Manik. So in this video we are going to study about the third non-odontogenic cyst of developmental origin, that is nasolabial cyst, or you can also call it as Klestadt cyst or nasoalveolar cyst. Now why is this name given? Because nasolabial cyst, that means uski location is somewhere in the nasolabial region. We'll study about the location more in the further part of video. Now this is considered due to entrapment of epithelium between globular process, lateral nasal process और maxillary process. कौन सी process है? Globular process, lateral nasal process और maxillary process. See, below the philtrum, this is going to be your globular process. This is in the lateral area of nose will be your lateral nasal process, and this is your maxillary process. तो ये तीनों process जहाँ पे fuse होगी, see. This is your maxillary process, this is your lateral nasal process, and this is your globular process. तो इन तीनों के fusion पे कहीं the cyst is going to be present. क्यों present होगा? Due to entrapment of epithelium. कौन सी तीन process है? First again globular process, lateral nasal process और maxillary process. Now some researchers also believe that it originates from nasolacrimal duct. From the lower part of nasolacrimal duct, the cyst can be originated rather than the epithelial entrapment. But these are the mixed views. We also saw the views of different researchers in previous cyst also, but the main cause was considered to be entrapment of epithelium, right? Next, moving on to the clinical features of nasolabial cyst. So the most common age for the occurrence of nasolabial cyst is going to be 4th and 5th decade of life, right? Most of majority of cases किसमें दिखे हैं? 4th और 5th decade में. The most common sex affected is females. Are 75% of the cases are seen in females, and males are comparatively less affected. And most common site, now site of this nasolabial cyst is going to be in the anterior vestibule of maxilla, right? Anterior maxillary vestibule कह सकते हो, beneath the lip, under the ala of nose. See, swelling in mucolabial fold. This is your mucolabial fold beneath the upper lip in the anterior maxillary vestibule, as well as you can also consider this in the floor of the nose, because nose is just present above it, being located near ala of the nose. आपको बस simple याद रखना है कि the cyst is present beneath the ala of the nose or floor of the nose in the mucolabial fold, or you can also consider as anterior maxillary vestibule just beneath the upper lip. कहाँ पे present होगा? At the junction of all the three processes, that is lateral nasal process, globular process and the whole maxillary process. इन तीनों के junction पे the cyst is going to be present. Now it is going to represent as a small painless swelling, right? कैसी रहेगी? Small painless swelling रहेगी. It is going to be usually unilateral, but sometimes bilateral nasolabial cyst have also been noted. The cyst is usually asymptomatic, but sometimes it may get infected and show signs of pain and discomfort. There are also various cysts which are large in size that are also seen. There are always going to be mixed clinical features, right? But you need to concentrate on the majority. कि majority of the cases में कौन से clinical features है, उस पे आपको ध्यान देना है. Not the rare ones कि एक या दो cases दिखे, उस पे आप ध्यान को नहीं देना है, right? Next, moving on to the histological features. So there is not much to discuss regarding the histology of nasolabial cyst, but it says that pseudostratified columnar epithelium is seen in the cystic lining. You will have the cystic cavity, connective tissue and cystic fluids. Now, few goblet cells are present along with the pseudostratified columnar epithelium. दो चीजें याद रखनी है. First is pseudostratified columnar epithelium along with goblet cells. Now this pseudostratified columnar epithelium is even sometimes ciliated. कुछ cases में देखा गया है कि this pseudostratified columnar epithelium is ciliated. So only this much about the histology of nasolabial cyst. Lastly, treatment is surgical excision. The surgical excision should be clean and clear, because this is considered to be an aesthetic area. So neat and clean scar should be given to excise the cyst. So this is all about the nasolabial cyst. It is a very short cyst. You just need to remember between the three processes, that is globular process, lateral nasal process and maxillary process. Age, sex, site, everything is clear. If you guys have understood the topic and enjoyed the lecture, then please like, share and subscribe our channel, and don't forget to hit the bell icon so that you get regular updates of our upcoming lectures. Thank you.